very similar tales that we continue to get in from other affected states here as well. This is a shocking case of medical apathy now that has been reported in Karnataka. And this one's coming from Bidar district. COVID patients who are seen sleeping out on the pavement, out on the streets there, just outside the hospital. They're literally begging to get in a bed for treatment. Now, this after the hospital having experienced a severe bed shortage. It could not accommodate the rush of patients here. The state has nearly recorded 22,000 cases in the last 24 hours. Acute infrastructure crunch there in the state of Karnataka that continues. Our correspondent Neha is getting us some more updates here on this. Neha, what is it that we've heard from the state government here? What is going to be the increase in beds in that situation across the worst affected districts?
Here, this is really, of course, most unfortunate that we're seeing, for the first time around this time in the second wave in Karnataka, wherein we're seeing patients have actually been forced to the footpaths, to the pavement. More importantly, Sahel, of course, when we did question the health minister about this, when he was asked about this, he in fact did go on to say that Bidar district being a slightly smaller district, there was just one main hospital over there. That was in fact, the Bidar Institute of Medical Sciences, or the BIMS hospital, where all of these patients are lying around. But what's important over here is to remember, Sahar, that this comes at a time when the government has already mandated that all private hospitals reserve 50% of their beds for patients. So even having said that, even the smaller private hospitals, of course, we're sure there are some smaller private hospitals in the district of Bidar, but it's really unfortunate that we're seeing how women over here are having to really, just wait outside. We also understand, from our sources that even till yesterday, some of the patients who were coming into the hospital were begging the doctors to treat them, even if it means treating them on the floor without the availability of a bed, simply because they were critical or they, desperately needed the treatment at that time. As far as the state government is concerned, Seher, it clearly seems like 1.5 years have gone by and yet no preparation coming in over here.